Well, Shiza, number one, thank you so much for having me on and for letting me share about telemedicine.
My pleasure.
Simply put, telemedicine is medicine delivered from a distance. Do you remember, Sheza, when doctors used to come to your home and make house calls?
Yes, yeah.
Well, now, thanks to advances in technology and telemedicine apps like CallingDr, patients can once again see their doctor, speak to their doctor, have a face-to-face consult, all from the comfort of their homes.
Wow.
Yes.
It's amazing.
It is, in many ways, it is. And you and I know that going to see a doctor should be a priority.
Yeah.
We know we need to look after our health, but being realistic, people are busy, life is unpredictable.
Yep.
And really going to a doctor's office
and crowd
going to a doctor's office and just for a 10 to 15 minute consult with your doctor face to face in an office building may not be worth it for many. So telemedicine and a CallingDr app is a wonderful option. I have been in the healthcare community for over 20 years.
Wow.
Mainly in physical medicine, rehab and therapy. But I first really felt the need for telemedicine over a decade ago.
Wow.
Hurricane Charlie had just come through Florida.
Yeah.
Remember?
Yeah.
And one of my children was sick. And at that point, I really didn't have any other option. I had to bundle the sick child up and head to the ER.
Right.
And now let's fast forward to nowadays. You know, we have a boom in communication, in connectivity. So many of us have a smartphone or a tablet or a computer with Wi-Fi or data services. And so now there's been a real popular movement and demand for distance healthcare. And so now we have telemedicine, or it's also called M-Health, which is mobile health.
Mobile health.
Yeah, and mobile health. And that has become more and more popular and is being used more and more of a demand because there's so many advantages both for the patient and for the doctor.
Wow.
The good thing is Medicaid, Medicare, and most of the 5 major health insurance carriers do cover some type of telemedicine. But this is always my advice to everyone when it comes to health insurance coverage. Contact your doctor, contact your health insurance carrier, just to make sure what there is a responsibility for the patient to pay. You know, the number one fundamental benefit, I would say, is an improvement access to healthcare. You know, telemedicine used to be used in providing healthcare for patients in distant locations. But now using a telemedicine app like CallingDr, you know, any patient, any location can get distance healthcare on demand or scheduled whenever they need it.
Yeah. You are saving time?
Yes.
You are saving transportation?
Yes. Everything. And not only is the instant access wonderful for the patient, I also think of the doctors and the healthcare facilities. They can now treat patients and have a far greater reach than the confinements of a brick and mortar office.
Wow.
And you know, I don't know whether you know, Shiza, but even in the United States, we do have a shortage of medical healthcare professionals.
Exactly. Yeah.
You know, in the urban areas, but even more in the rural areas. And a telemedicine app like CallingDr can really have this unique benefit that we can reach out to these patients and provide them with distance health care.
Wow.
So that's
It's
one of
amazing.
Yeah, it is. And you know, that's one of the greatest advantages. I think a second advantage that we should mention is cost.
Right.
You know, cost is a big factor in everyone's life.
Yes.
It is, right? So I have to say that to contain healthcare costs, and in some cases reduce healthcare costs, that's why telemedicine is being adopted. So for example, if you have the CallingDr app and you utilize that, you are controlling the cost of transportation.
Right.
You're not going anywhere, right? You don't have to take time off work. There is better outcomes.
Right.
and definitely higher patient satisfaction. So that
and quick care.
And quick care.
Yes.
So we're saving time, and you know we all say time is money, right?
Yes, of course.
Yes. So we have the instant access, the increase in access. We have a cost, and you know what I also have to mention is an improvement in quality.
Yeah. It's not about only patient. It's very useful for doctors too.
Exactly, exactly. It is useful for doctors.
Useful.
So you have to think that telemedicine also has the benefit of having better management of chronic conditions.
Right.
So that's better outcomes, greater patient satisfaction, and you know that's really the two goals for a physician, right? To get their patients well and to have a greater satisfaction when it comes to the patient satisfaction. So make it very easy with the CallingDr app.
Okay.
We only have a little bit of equipment, and it's equipment that people have at home. It's a smartphone, it's a tablet or a computer with data or Wi-Fi access.
Yes.
And for the patient, we make it even easier. What we do is we allow the patient to use their own smartphones. And so the reason they use their own smartphones is because it's more familiar, they don't have as many patient use errors, and for the doctor's offices, what we do with CallingDr is we actually physically go into their office, we transition the whole practice so they are familiar with it, and we even use their own equipment. So if they have computers, we actually use that.